Hello, everybody. Welcome back to the Physical Therapy San Pedro podcast. This is episode 48, and today we are reintroducing the PTSP team of 2024. I am your host, Dr. Janae Brown, and I am joined by my amazing team. To my left is
Dr. Bay.
And to my very, very left is
Alonzo, but I go by Zoe.
And to my right,
Dr. Silverton.
Awesome. Okay, so you guys might notice someone new at the table today and someone not at the table today. Our team is a constant place of change, and over the past 7 years, we've had many, many great clinicians work with us and come through and be on our team, and some have come, some have gone. But the thing that we pride ourselves in at Physical Therapy San Pedro is delivering excellent care to our patients here and bringing our skill and knowledge to everybody as well. So team changes, and things have changed with us growing, or just life changes, things happen. And so we are bringing you today a new person on our team, Alonzo, Zoe. And we have decided this year, as we've changed our team, to bring on strength and conditioning into our center. So we're trying to expand sort of what we're doing here. And the thought process behind that this year is to deliver another level of care for our clients and our athletes that are returning back to sport and need an extra layer of skill and knowledge as we transition our clients from patients. And also for us to be able to provide care beyond physical therapy. So when our clients and patients end with physical therapy, we want to provide a space for them to continue training with us and using our center and using our staff and using our expertise to continue being strong and healthy and performing their best in their sport, or on and off the field, or even the gym, wherever they kind of need help. We want to be able to provide that level of expertise. So that's why we brought on Alonzo onto our team. So he's our new addition, and I'm going to let him share as we introduce ourselves to you today, a little bit about himself as we get there. So I'll start by introducing myself. My name is Dr. Janae Brown. I am a physical therapist. I've been a physical therapist for over 2 decades, is what is in the blog. So feels like a very long time. But I graduated in 2005 from Loma Linda University. Prior to that, I went to the University of San Francisco and got my bachelor's degree there in exercise and sports science. And I knew I wanted to be a physical therapist probably sometime in high school. I played basketball when I was younger. I actually was a cheerleader like Dr. Bay.
That's right.
For many, many years. And then when I got into 7th and 8th grade, I met somebody who was a coach, actually one of the football coaches. His sons played football, and he was like, "Hey, have you ever played basketball before? I think you'd be really good." And I'm like, "Basketball? No way." I ended up playing and loving it. And then I transitioned into playing basketball 7th and 8th grade, and then played in high school. And in high school, I had a couple of injuries that exposed me to physical therapy. My aunt was a nurse at that time, and she was like, "You need to stay in healthcare. You'll always have a job. Healthcare is the thing that you want to do," and we saw that with the pandemic, right? So everybody who was in healthcare had jobs, and we didn't close, and we kept working. So it was a good choice. And I love sports. So I was trying to combine sort of like healthcare with sports. So physical therapy is a great place to be if that's your passion. So I ended up deciding I'm going to be a physical therapist, and pursued all my pre-physical therapy courses while getting my undergrad. Chose Loma Linda for graduate school, and I knew when I walked on that campus it was the right place for me, and I had a wonderful experience at Loma Linda. So shout out to all my LLU alumni out there. And then when I came out of school, I knew at some point I wanted to open my own practice, but I didn't know how that was going to look, because I also wanted to have a family, and I actually got pregnant my 3rd year of PT school. So I was navigating that and being married very earlier than I thought I was going to be doing. So I ended up working, my first job out of school was in a Pilates clinic. It was all basically all the equipment we had was Pilates. So the owner of that clinic was like, well, if you're going to come on board, I'm going to need to put you through a Pilates certification. So I ended up doing the STOT certification, learned Pilates, and learned how to just basically, as a new grad, work with Pilates machines and use my manual skills. And that's kind of all I had and everything I knew that I could use in terms of like body weight stuff. And then after that, I was there for a short period, about a year. And then I went to Health South, which they worked very closely with the Curlin and Job group, and it was very much sports medicine. And that exposed me to sports medicine and enjoying kind of working with all different kinds of athletes, professional athletes, high school, college. And then I went from there to an outpatient clinic that was like 50% ortho, 50% neuro. And I had actually really good neuro teaching and really good neuro professors in my program at Loma Linda. So I kind of took the job with a little bit of fear in me because I'm like, I don't really like neuro that much, but I really love the clinic I chose to work at because I was a intern there. So ended up going on board there and doing a lot of neuro, stroke rehab, MS, worked with MS patients, worked with brain tumors. And then the other side of the caseload was a lot of orthopedic stuff. So knee pain, neck pain, back pain, ACL tears, meniscus tears, all the orthopedic things that at that time when I was first practicing, and that was like the 2005, 2010 timeframe, we didn't really have a lot of sports rehab. It was just like orthopedic rehab. And if you had a sports injury, you went to an orthopedic clinic essentially. But I knew I loved sports. So I practiced there. Then I actually ended up going into some management and ran I actually went into skilled nursing for a little bit, more for a personal change to be at home a little bit more and be able to like be at my daughter's events and things. And so I ran and oversaw the Southern California division of Burger Rehab. And that was like 10 clinics. And that gave me exposure to like managing people, managing things, managing all the day-to-day operations, overseeing hiring, firing, all that stuff that's fun and not fun. And at that point, I realized, okay, I have all the skill sets and the basis to open my own practice. And so I decided to take the leap of faith and do that. And a little bit what pushed me into doing that was I knew I wanted to open a practice, and I was like, how do I get there from like actually doing it? And I went through a consulting group through the Aaron LeBauer. Shout out to Aaron LeBauer. He has a consulting group for private practices or people who want to open he actually does cash-based practices. So I thought I wanted to do a cash-based practice at the time because I'm like, I don't want to deal with insurance. It's too complicated. And so I ended up going that route and going through his consulting group. And when you're done with his modules, he had modules, like an online program with modules. When you were done with it, it was like, okay, go look for your lease. And I was like, oh my God, I need to find a space. So that's what I did. I found his idea was find a space in a space. So I rented an office in a wellness center and sort of just built my practice from there. And our practice has grown we opened originally in 2017, January 2017. It was just me at first. And then I hired an aide, and that aide did my front office and back office stuff. And then I brought on another physical therapist. That was Dr. P at that time. And then I brought on another aide, and then we started to outgrow the space that we were in. And I think in late 2020, Dr. Bay came on board. That was December, right? That you came on board and joined us at our previous space, but we had planned to transition to our current space in 2021. And so she was with us at the end of that year. We moved into our current space 2021, and we've been here now 3 years. So and over this time, our practice when I first opened was we were treating kind of everybody, the general orthopedic population. And then I decided I really wanted to niche our practice to sports rehab because I was passionate about sports. I was passionate about the youth athlete. And I think that first year in practice, it really just exposed me or reminded me this is really what you love and what you're good at. So focus here. So I niched our practice that way. And we started to reach out to community sports teams and high schools and dance groups and all kinds of stuff, and do free injury stuff on the sideline. And I just tried to put myself and our clinic in a place where we could do some of that stuff to support our community, but also bring in that clientele to our center to let them know this is what our expertise is, and this is what we're passionate and we love to do. And we've just over the past 3 years brought in a lot of clinicians that have had different expertise, whether it's martial arts or dance or weightlifting, or soccer, basketball, volleyball, gymnastics. We've had a plethora of different staff members who have had passion for different sports. And myself, I played basketball, and then over time, for me, I became a concussion specialist because I got on the sideline a lot more with our teams, and I thought, okay, I can like clear an athlete, but I'm like, what happens if they go down? What am I going to do if someone has a concussion? So I felt like I needed to get that specialty, and ended up doing a concussion certification through that time. So my specialties are concussion rehab, sports physical therapy. I loved working with athletes that play team sports. I have learned a lot about dance because early on in my career, when we developed a partnership with the local dance company, San Pedro City Ballet, I was doing a lot of the dance PT. And then Dr. Bay ended up coming on board, and she's going to tell you about herself, but she ended up taking over that program, and it's her baby now, thank God. And so I stepped away, and I don't do the specifics, but I support whatever needs to be supported. Of course, I feel like I can treat any patient that walks through my door, but I love that she has the specialty, and she's passionate about it and is an expert in it as well. I am Pilates certified, so I utilize Pilates as a tool for my patients. I've done rock tape training. I'm a certified functional strength coach. So I did that through CFSC a few years back. And I've done just a lot of different training and courses and things to just help me feel really good about working with any client going from, the beginning phase of like an injury to return to sport. So that's a little about me professionally. I've talked a lot. Personally, I'm married. I've been married for 20 years. My husband is a wonderful man, and he runs his own independent business. He has a record label, independent record label. So he's the music business, completely different from what I do. My daughter is a junior in college, and she is a swimmer. So I've been able to experience the athlete from, the clinician side of being a physical therapist, but also from the parent side of kind of having her as a swimmer since she was 8 and dealing with different injuries and having to rehab those for her. We've rehabbed a lot of things. And so as my staff, they've rehabbed a lot of things for her. Dr. Bay shaking her head.
Yes.
She's seen probably every one of the clinicians we have. And so Dr. Silverton, you might see her. Yep. And Alonzo, you might be doing some training with her. We'll see what happens. But, and when I'm not working and I'm not with my family, I love to take care of my own health. I love to work out. I love to shop. It's my little vice. And just like enjoy life. So that's a little bit about me. I want to stop talking. So I'm going to move this on to Dr. Bay. So Dr. Bay, tell us a little bit about yourself.
Thank you. Yeah. So my name is Miley Bay Jaquez. I'm born and raised in San Pedro. And the big joke here is that if you went to San Pedro High, you graduated with a PhD. So I have a Pedro High diploma back in 2002. I left town to go to school at UCSB, where I studied biology, and I got a BS in biology. And then my lifelong passion of dancing, I started back at age 4, really helped me to kind of just really fall in love with the way the body moves. And I just felt like, okay, I want to work with people. I don't want to sit at a desk. I want to continue to learn about the body, and I really love learning about how it moves. So that led me to physical therapy. So by the end of high school, I had decided, okay, I'm going to try to apply for physical therapy school. So I got into USC, and I graduated in 2009 with my doctorate of physical therapy from USC. While I was there, I got my certified strength and conditioning specialist certification. So after school, I started practicing in outpatient orthopedics. So that leaves me now 15 years as a physical therapist this year. Felt like that was kind of a big milestone.
Mm-hmm.
Like, okay, at 15 years, you're pretty good at this.
Yeah.
You know a good amount. You've seen a lot now.
Mm-hmm.
I initially started practicing just generally in outpatient orthopedics, always wishing to work with a more athletic population, especially pursuing dance. But I just didn't know if me wanting to stay in San Pedro, and keep up my lifestyle that I have here would allow me to pursue dancers because I thought, oh, I'll have to go into LA. But when I saw Dr. Brown had created a relationship with some of the local dance studios here, I got really excited and I asked to come aboard our team here at Physical Therapy San Pedro. Luckily, she had room for me.
Created room.
Yes. So I feel very lucky because since I've been here, I've gotten to really kind of live out my dreams career wise. I took on our dance program, as she mentioned. So I work with two local companies very regularly, and sometimes I get to help dancers from other surrounding cities. But primarily, I am treating dancers from San Pedro City Ballet and the Dance Factory. And I not only do physical therapy with them, but I also help do their injury prevention and strength and conditioning programs. So I feel very fortunate to be participating in that. I try to also help create social media content to help just educate because I'm very passionate about letting the youth upcoming know what we do here at physical therapy, what the possibilities are, how can you enhance your training. Sometimes I have dancers come in to see me without an injury, which is wonderful as well. We get to just do strength and conditioning with them. But in general, I like to incorporate all of my interests into my physical therapy work here. So, and specifically, I have always loved doing Pilates. I was exposed to that as a dancer. So, like Dr. Brown, I'm not certified, but I've had as many years of Pilates as I have as of physical therapy, and a lot of one-on-one private work in Pilates. So I like to utilize my Pilates skills to help patients understand how to get their muscles working properly and how to stabilize and how to move better. I like to help patients with other aspirations like yoga or just really any athletic aspiration. But you will see me using a lot of Pilates, yoga, TRX, kettlebell work. Those are like courses I loved a lot. And then lately, I love the science behind blood flow restriction training. That's something I think really helps our patients excel at a faster level. And then I love how coming here to PTSP has challenged me to progress my skills of return to sport training. And I've loved everything I've learned here and that our team has been able to teach me for that so I can expand beyond my world of dance more.
Love it. The goat of dance, Dr. Bay. What about you personally? Do you want to share anything about your family or you?
Yeah.
What you like to do when you're not here?
When I'm not here. So I mentioned I dance and I still dance, which I'm very proud of. It's easy to stop your sport, but I hope to dance, as long as I live, because that's my big passion. If I don't get to dance, I don't feel me. I have a husband and 2 daughters and a dog and a great community of friends and family here in town. So I just love spending time with my people and traveling whenever possible and staying active. Dance, Pilates, yoga, exercise classes. I hate to come up with my exercise. I like to be told what to do because we make so many decisions here every day.
So many.
I want someone to just plan it for me.
Yeah, that's good. 2 things. My dog Jackson would be mad that I didn't mention him because you mentioned your dog.
Yeah, Brittany.
Yeah, Brittany and Jackson
Brittany
are
is my
boxers.
first child.
And what was the second one? It's gone. I don't know. Something you said that triggered something, but it's not there anywhere. All right, let's move on to Dr. Silverton. Dr. Silverton has joined us this year. So he joined us, what are you at? Almost 3 months now, right?
Yeah.
Tell us a little bit about yourself.
Let's see. Born and raised in Orange County. Lived there till end of high school. Went to Garden Grove High School. Then from there, for college, UCSD gave me the most money, so that was almost a full ride for me at UCSD. So that was nice. Studied human biology. Got my bachelor's in that as well as a minor in psychology. That was when I started learned about parkour in the first place, and so I started practicing that. Just Early days, think like skater street culture days of parkour. So I'm an old fogey at that. But that's where I learned just movement, training, getting stronger, drilling things. I loved it just because it was very goal oriented and movement oriented. It didn't matter how you went about doing things because there's lots of ways to move. There's no one right way. But if it works, it works. So that stuck with me, and that kind of led me looking into different careers that would allow me to do that as well. So physical therapy was one of those things that stood out to me as I learned more about it. Then that's what I decided I wanted to stick with. So I went and got my master's at Cal State Long Beach. Finished that up, and then worked for a bit. Got my OCS, orthopedic certified specialty. After a few years, got my doctorates up at Western University of Health Sciences in Pomona. Um, Early on in my practice, I kind of worked in all the different settings, hospital-based, acute rehab, skilled nursing. So I've seen people fresh out of surgeries, fresh out of injuries, even saw some people in the ER and ICU. So seeing the whole broad spectrum, I always kept a foot in the orthopedic realm just because that's what I enjoyed. I'm just methodical in that, and I like to do those types of diagnoses and just trying to figure out why is it that this person can't do the thing that they want to be able to do. So that worked well with my brain, and so I stuck in orthopedics. Worked in the Long Beach area for several years before opening up my own practice in Lakewood. Unfortunately, just at the very beginning of COVID, not the best time to open up a practice. But we built out a space inside a gym, very similar, but it was a big box gym. Ran through the ups and downs of managing a clinic, which can be hectic, working for a large company in network insurances and all. Good choice on the cash based.
Tried.
I started wondering why my patients weren't getting stronger because I was still doing the things that I taught in school. And then I just started looking into, weightlifting, resistance training, and how that still jived with all the research as far as progressive loading, how to combat like sarcopenia, osteopenia, osteoporosis, and starting incorporating that into my practice a lot as well. So I always treated everyone, all my patients as individuals, and always try to get them closer to their goals. Again, I'm just a one-track mind as far as like, hey, what do you want to do? What do you want to be able to do? So I always keep that at the forefront. And if they want to be able to do more, then you got to do more as well. And that worked well, except for the population didn't always understand that also. So that got a little tiring, having to repeat myself as far as like, you want to be strong, you want to be able to lift your kids, you got to get stronger. After doing that for several years, I'm about a dozen years out of having my degree now and being practicing. Came across Dr. Brown's clinic, and you've developed a very nice clientele here that are they come here, they want to work, they understand the value of hard work, and that it gets them closer to it, and I can push them harder just because they already understand that. So I've been able to apply that skill set very well here, and it's been fun so far.
Awesome. It's cool. And what do you do when you're not practicing at Physical Therapy San Pedro with all your clients here?
Playing with my son.
Play with your son.
Do house projects, DIY stuff, gardening, cooking, all the things I enjoy. My son is he's 6 right now, so take him to a parkour gym down in Westminster. Firestorm free running. They're actually really good down there. They're great at training the kids, and my son has a blast climbing, playing tag, trying to hit me with foam pool noodles all over the place. And he'll climb like 2-story structures along with me and try to chase me down and tag me and everything. So, and he's come a long ways as far as understanding how to move his body, how to navigate an environment, how to know his limits as far as what he can do and what he's not ready for.
Yeah, very cool. It's fun. Thank you for sharing. Okay, we're heading down the train heading down south to Alonzo Davis, known as Zoe. tell us a little about yourself. So,
Yeah, so I was born and raised in Bakersfield, California. Me and my three brothers, so there's four of us in total. Went to Frontier High School where I played football, basketball, and I ran track. I was a CIF state prelim qualifier for the 300-meter hurdles. I played college football at Humboldt State after I graduated. I was there for a year and a half until our program was cut due to budgets. I know it broke my heart, believe it or not. I was like, especially after I had such like a great senior year. I was hoping to like carry that into my freshman year, which I did. And then I was like, sophomore year is going to be the year where I, perform my best, where I go ahead and show my teammates and my coaches what I can really, really do. And then like, hey guys, our program's getting cut. This is our last season. I was like, okay, well, that's just fantastic. So once I did that, I ended up transferring back to Bakersfield, California, where I went to BC, so Bakersfield College. Started there. What happened? I ended up I rolled my ankle really, really bad. Yeah, by like the second week, I think. By week 2 or week 3, I had like a really bad ankle sprain. Like every athlete in the world tried rushing it. Ended up re-rolling it again. Ended up getting upgraded from a grade 1 to a grade 3. And I missed the rest of my season after playing just 3 games. So that was really gut-wrenching, but it's kind of where I learned my passion for wanting to know about the human body, understanding why is it that something as simple or small as my ankle can immobilize me to the point where I can't even walk, I can't run. How is that something so small can have an impact so large? And talking to my trainers, and I even went to go see a physical therapist at the time, and they introduced me to the anatomy behind it all, understanding how the body works and what joints and what certain muscles are allowed to do and what their responsibilities are, which was astounding to me because at that time I was a criminal justice major. So I had no idea what it is I wanted to do in my career. I just knew I wanted to play football. But once I got exposed to my own injury and I learned how to rehab it and how to control it and how to come back from it and how it works, it actually like intrigued me about, okay, well, if this is how we do it to recover from injury, how does this affect the way we're able to run faster, jump higher, and everything else? So then I started to ponder a little bit about what it is I wanted to do career-wise once football was over. Decided that kinesiology was the route I wanted to go because I was really, really passionate about learning about injury prevention and recovery from injury. Ended up transferring to Sac State where I looked to continue my playing career there and playing football right at the same time COVID hit. So went from cut program, sprained ankle, COVID. So I was like, man, these are the most eventful 3 years of my entire life. But still there, that's where I got my first gig as a physical therapy intern, like an aide intern at a physical therapy clinic. And the things that I learned in my 4 months there as an intern was groundbreaking. Like I learned so many different things that I didn't really know, to where when I got to Sacramento and I was in my first semester, I ended up changing my major to kinesiology. So I had my first 2 years done all GEs and I started doing more concentrated field work in that discipline. Learned a lot about the body in terms of injury, recovery, and had goals of going to PT school. Went through all that rigmarole, applications and interviews, and got into a program, but ended up backing out last minute because I just decided, well, is this really what it was I wanted to do with the rest of my life? I know I loved injuries. I know I loved recovery and, the rehabilitation process, but I also loved performance and sports. So I was kind of stuck in between about what it is exactly I wanted to do. Ended up applying to get a basic master's or a general master's in kinesiology with like different focuses within the discipline. I got into San Diego State, San Jose, Long Beach, and then CSU Northridge. So I had 5 different avenues of what I wanted to do career-wise in terms of making an impact, not just in my life, but also making an impact on, individuals. Decided that going the master's route would give me the best opportunity to stay in not only the performance realm, but also dabble with injury prevention and understanding how we can increase recovery times and decrease injury risk. So I ended up accepting my offer to Long Beach State, where I've been there for going in my second year now. So I'm completing my second year. I'll be done in May. So I'm currently working on my thesis. So that's something to look out for in the future. I hope to get it published once I'm completed with it as well. And then, now I'm here. Hopefully I'll pursue a PhD in biomechanics so I can further my knowledge and further my impact on the population of people I want to help.
Awesome. And what do you do in your free time when you're not a strength and conditioning coach?
Believe it or not, I love to do research. I always enjoy doing research. So I'll go home, look up a couple articles about things that I'm curious about how we can improve the disciplines within weightlifting, because that's really where my passion lies. Obviously, being strength and conditioning. Talk to my friends. I just love like watching football, like going to play basketball, playing flag football on the weekends with a couple of my buddies. And I actually just got involved with pickleball, believe it or not. Yeah, I got introduced to that. I
Don't
think
do that.
about
You're going to get
a
hurt.
month ago. No, I'm getting too competitive. That's what the problem is. I'm going out there now. I'm just hitting it against nobody. I got to get my feet right. I got to be able to slide.
I
Yeah.
feel like you're too young for pickleball.
We were playing PBTV on the television over
Oh,
the
really?
last week, I think. Yeah,
Oh,
pickleball
wow.
TV. There's a
Oh,
whole
wow.
station
Yeah,
for
it
it.
gets
It's
it
like
gets competitive.
it's an epidemic right now. Pickleball. Okay. We're gonna chat through a few of these things and then we'll wrap up. So, what do you guys think our mission is? If you guys were to say like working here, what do you guys think that if you were to give a little description on what the mission of Physical Therapy San Pedro is, what would you say that is? We'll start with Dr. Silverton.
Good.
I'd say take people from injury or pain or any sort of thing that they're not able to do. We're back to at least their baseline, but also give them the knowledge and empower them to be able to grow beyond that, and that make them more resilient, so that way they're less likely to get injured again, or at least if they do, they know what to do at that point. Where I guess that part of what makes me a bad business person is that like I don't want them to come back to me. I just wanted them to live happy lives, and as active as possible, so they can just be healthy and do the things that they want to do with the people they want to do it with.
Yeah. I feel like when we think about we don't want them to come back to us, I think we should think a little differently. Like I think what we don't think about ourselves as physical therapists and strength coaches and personal trainers, that everybody should have someone like that on your team, just like you have your physician or your dentist or your whatever, so that if you have an injury or you need guidance, because we're all if you're an athlete or if you exercise or you work out or you do anything, you're going to have injury, right? So at some point, you're going to need some guidance and advice. Maybe you don't need to do physical therapy for a course of 12 sessions, but maybe you tweak your ankle and you're like, okay, I'm going to go see my PT real quick and get some advice because I want to get back on track. Maybe it's a visit or two, but we should be sort of a person on people's team, and they know that they can come back to us. And that's kind of what a lot of our patients are. They return back, not for the same thing, but often like, we know that you can get us better and help us. So we're coming back to you for that reason. So it's kind of that, but I get what you're saying. Yeah. Not like where you're just ongoing forever having physical therapy, but for the same thing. Yeah. Dr. Bay, what's our mission?
I think we here at PTSP like to take a very individualized approach to helping our patients. We're given the gift of time here. Dr. Brown structured our center so that we can spend more time with our patients than most other places I've been and hear about. And I love that we have the ability to create a brand new program every session if we dreamed. A patient can walk in and say, this is what I want to work on today, and I can shift gears and help them do that. So I think we take a very individualized approach to help all people reach their athletic goals. And then I think we also take a lot of time on education here to help people understand what it takes to be a well-rounded athlete, how to protect your body, how to prepare your body to work, how to recover. And then I think we do a lot of education for the community and outreach to the community here at PTSP. And I think that's really a really important fiber of what we do, helping our youth athletes, helping them with injury or helping them prevent injury.
Good stuff, Dr. Bay. What do you think, Dr. Zoe? It's going to be Dr. Zoe. Actually.
Yeah, well, hopefully
It will be.
Yeah.
We're going to have to start calling you that soon. So I'm just getting prepared. But Dezo, yeah.
Dezo. Oh, that's a good one.
I know.
like that.
What do you think, Zoe? You've been here since a couple months now, or almost.
It's
so
been,
what?
I think it's been 1 month. Exactly.
1 month exactly.
1 month and a week.
1 month and a week.
Yeah.
What, based on what you have been here for this time frame, what would you say the mission of what we do here is?
Well, kind of piggybacking off of what Dr. Bay said, I think our biggest goal is to not only treat patients and get them healthy, but also education, understanding why it is important to engage your quads during this exercise, why you want to sink into your hip when doing this, or brace your core when doing, like a squatting exercise, and just getting the patients to not only understand what it is we're trying to accomplish, but also with that, they get more of a buy-in because we explain what it is we're doing and how it's going to help. They do it, they feel so much better. And a lot of things that I ask the patients here, and I'm pretty sure that you guys do as well, is do you feel better than when you came in? And it's always a yes.
Mm-hmm.
So I think just knowing that not only do we help them recover from injury or return to sport, we also educate them in the long term or in the long run, like what are things that I need to be really, really good at, and how can I prevent myself from getting into further injury by just having these small little cues that my strength coach or my physical therapist taught me how to do.
Yeah, it's good. I don't even need to say anything because you guys kind of really wrapped that all up for us. And just, I feel like we just want you guys to move well, move better, be strong, and get back to the things you love to do. That's really what it's about. So we offer here sports physical therapy, dance physical therapy, concussion rehab, and strength and conditioning. And so those are our services. We all do those things. And so much more. So if you are interested in if you have an injury or you are looking for some help with just getting stronger, moving better, being a better performer in your sport, we are here to help you. We help and treat our clients and patients in our center here in San Pedro, California, which is in Los Angeles. But we also do virtual physical therapy and strength conditioning as well. So you can reach out to us and get services for those things online. We also have a website full of great information, which includes some online programming that we've started to develop. So we started an ankle program, so you can check that out. We have an Instagram page, a Facebook page. We try to give you guys education and content as much as we can across those platforms. And we have this YouTube and podcast going on our YouTube page and on our podcast. So we have 47 other episodes that you guys can go check out, which have a great amount of information for you guys. We will be getting our thoracic spine series next. So stay tuned for that. And to come in this next several months is the 12 days of Xmas, which Dr. Bay leads. So you guys will have to join us for that. That'll be fun. She coordinates all kinds of fun stuff for us. So that is us in a nutshell. We will see you guys next time. And thank you guys for tuning in. We hope you learned a little bit about our clinic and a little bit more about us, which would make you comfortable to come here and seek services from us. Till next time. Bye, guys.
Bye.